Hello everyone, I'm Dr. Monica. Today in this video we will learn about principles of periodontal instrumentation. So let's begin with the topic. So let's quickly understand the various components of principles of instrumentation. First is the accessibility, which includes the positioning of the patient and operator. Second is visibility, illumination and retraction. Third is the condition and sharpness of instruments. Fourth is to maintain a clean field. Fifth is stabilization of the instrument. And sixth comprises of activation of the instrument. So let's discuss the first component of accessibility, which is the position of the clinician. Firstly, the clinician must be seated comfortably in the operating stool. Secondly, the feet of the clinician should be flat on the floor with the thighs parallel to the floor. Thirdly, the clinician should keep his back straight and the head erect and be able to observe the field of operation clearly. So let's discuss the next component of accessibility, which is the position of the patient. First, let's talk about patient position for maxillary arch treatment. In this, the dental chair back has to be kept parallel to the floor, and adjusting the headrest should be done in such a manner that the patient's head is in chin up position, with the top of the patient's head should be even with the upper edge of the headrest. The patient has to be asked to lie down in the chair so that the feet it has to be even or slightly higher than the tip of the nose. So now let's discuss the patient position for mandibular arch treatment. In this, the dental chair back, it is slightly raised above the parallel position at an angle of 15° to 20° to the floor, whereas the headrest, it is adjusted in such a manner that patient's head is in chin down position, whereas the position of the head and the body, it is similar to that of the maxillary arch treatment. So now let's talk about the second component of principles of illumination, which is visibility and illumination, and it can be achieved by first one is direct vision and direct illumination, which is considered to be the most desirable method. Second one is by using a mirror to obtain indirect vision. Third one is a mirror is used to reflect light, which causes indirect illumination. And fourth one, it is achieved by combining indirect illumination and indirect vision for viewing the palatal and the lingual surfaces of upper and lower arch. Now talking about retraction, it is done to provide visibility, accessibility and illumination. For this, mouth mirror can be used to retract the lips, cheeks and tongue during procedure. Also, we can use the operating hand to deflect the cheek, while the fingers of non-operating hand can be used to retract the lips and protecting the angle of mouth from the instrument use. Coming to the third component of principles of instrumentation, which is the condition and sharpness of instruments. So first of all, whenever any instrument is used, it has to be clean, sterile, and it must be in good condition. Second thing is, if any pointed instrument or any kind of bladed instrument is used, the working end, it has to be sharp for it to be effective. Also, it helps the clinician to work more precisely and efficiently by increasing the tactile sensitivity with the sharpness. If the instruments it is dull, so what will happen is the whenever the clinician uses it, there will be unnecessary trauma and also there will be incomplete calculus removal. So now let's talk about the fourth component of principles of instrumentation, that is to maintain a clean field. So why is it so important to maintain a clean field? So whenever there is good visibility, illumination and retraction, instrumentation can be still difficult if the operating field it is contaminated by blood, saliva or debris. So to achieve proper instrumentation, we can use saliva ejector or an aspirator. Also, we can use the cotton gauzes to wipe or to blot the blood and debris. Also, sometimes we can use water to flush the operative field to make it more clean. So coming to the fifth component of principles of instrumentation, that is the instrument stabilization. In this, there are two important factors which help in providing stability, which include the instrument grasp and finger rest. These two factors, they are essential for effective instrumentation. Also, these two factors help in avoiding any kind of injury to the clinician or patient. Coming to the instrument grasps, the first one is the standard pen grasps. In this, the instrument is held as pen by using the thumb, index finger, and the middle finger. Second one is the palm and the thumb grasp. In this, we can see that the thumb is used along with the four fingers with the help of the palm, and it is used to stabilize the instruments during sharpening procedures. But the only drawback with this is there is less maneuverability and tactile sensation. Now coming to modified pen grasp. In this, the thumb, index finger and the middle finger, they are used to hold the instrument like a pen. In this, the middle finger, it touches the instrument shank with the side of the pad next to the fingernail, whereas the index finger, it is bent at the second joint and it sits higher than the middle finger, both on the same side of the instrument handle. So this modified pen grasp, it is considered to be most effective, and it provides a stable grasp as well as it increases textile sensitivity. Coming to the finger rest, it is used to stabilize the hand and the instrument by providing a firm fulcrum. Finger rest also prevents injury and laceration of the gingiva and surrounding tissues by poorly controlled instruments. The most preferred finger which is used as finger rest is the ring finger, whereas the middle finger, it is not very much recommended to be used as finger rest as it restricts the arc of movement during any activation strokes. So let's talk one by one about various intraoral finger rests. First one is the conventional finger rest. In this diagram, we can see that it is established on the tooth surface immediately adjacent to the working area. Coming to the second one, which is the cross finger rest. In this, it is established on the tooth surface on the other side of the same arch. Coming to the third one, which is the opposite arch finger rest. From the name itself, we can see that it is established on the tooth surface of the opposite arch. The fourth one is finger on finger rest. In this, it is the rest is established on the index finger or the thumb of the non-operating hand. Now talking about the various extraoral finger rests, the first one is the palm up fulcrum. In this, the fulcrum is created by resting the back surfaces of the middle and the ring fingers on the skin over the lateral side of the mandible on the right side of the face. Coming to the palm down fulcrum, in this we can see that fulcrum, it is created or established by placing the front surfaces of the middle and the ring fingers on the skin over the lateral aspect of the mandible on the left side of the face. Intraoral and the extraoral fulcrums, they can be reinforced by placing the index finger or the thumb of the non-dominant hand on the instrument handle or shank to enhance control and to apply pressure effectively. So coming to the last component of principles of instrumentation, which is the instrument activation. In this, the main component is the adaptation, which refers to the manner in which the working end of the instrument it is placed against the tooth. In this, we have to be very careful while adapting bladed instruments like curettes and sharp pointed instruments like explorers, which are usually difficult to adapt, especially in subgingival areas. So for proper adaptation, the lower third of the working end of any instrument, they have to be kept in constant contact with the tooth while it is moving over the varying tooth contours. Let's look at the diagram. In the first diagram, the leading third of a curate it is termed as toe, whereas the leading third in case of sickle scaler is termed as step. Coming to the second diagram, which shows a correct adaptation of a sickle scaler, in which the tip third of the sickle scaler it is correctly adapted to the facial surface of the incisor tooth. Whereas the next diagram, it represents incorrect adaptation. In this, the middle third of the working end, it is incorrectly adapted to the tooth. In this, we can see that the instrument tip, it is sticking out and it can injure the soft tissue. Now look at the diagram. If only the middle third of the working end it is adapted on the convex surface, the blade contacts the tooth at the tangent, the toe or the sharp tip will cause trauma and discomfort to the soft tissue. And if only the toe or the tip is in contact, the soft tissues, it can be distended or compressed with the back of the working end, which will also cause trauma and discomfort. So curate toes in this manner can gouge or groove the root surface. Now let's talk about angulation, which refers to the angle formed between the face of a bladed instrument and the tooth surface. So it is a tooth-blade relationship. So the factors on which angulation depends on is the amount and nature of calculus, the procedures which is being performed, and the condition of the soft tissue. So let's look at the diagram of blade angulation. The first one is 0 degrees. It is considered to be a correct angulation for blade insertion. Second one is 45 to 90 degrees. It is considered to be correct angulation for scaling and root planing. In this, the blade can effectively remove the calculus. The third one, it shows less than 45 degrees. It is incorrect angulation for scaling and root planing. In this, the blade, it smooths or burnishes the calculus instead of removing it properly. The fourth one, it is more than 90 degrees. This is also considered to be an incorrect angulation for scaling and root planing. Instead, it is a correct angulation for gingival curettage to remove the pocket lining. This is the diagram which shows proper angulation of periodontal probe, which is parallel to the long axis of the tooth with a probing force of 25 gram. Talking about the strokes, these are of three types. First one is exploratory, which is light feeling stroke. Second one is scaling, which is short powerful pull stroke. In this push scaling motion, it is rarely used. Third one is root planing. In this moderate to light pull stroke is used, and strokes can be activated by pull or push motion. So the vertical and the oblique strokes, they are the most frequently used strokes, whereas the horizontal stroke, it is selectively used on line angles or deep pockets where vertical and oblique strokes cannot be used properly. Please like and subscribe this channel. Thank you.